These are the chemo side effects that nobody prepares you for until now. Hey, Dr. Amy here. After interviewing over 5,000 cancer survivors, here are the worst chemo side effects. It's eye-opening. In this video, I'm breaking down the most common side effects and what you can actually do about them. You have control. So whether you're newly diagnosed, in treatment, or even years out from your diagnosis, this video is for you. If you do not understand what's happening in your body, you can feel anxious, dismissed, or even stuck. You do not need to be suffering in silence like nobody understands. But here, the right strategies can change how you feel. It's time to leave cancer in the past for good. So here are the worst side effects from chemo, starting with number 1. Low energy. Low energy is by far the most common side effect of chemotherapy. It's estimated that between 86 and 100% of cancer survivors experience exhaustion. When I asked over 5,000 women which side effects hit them the hardest, exhaustion was number 1. It was at the top. Now, I'm not talking about a little tired. I was diagnosed with stage 3 cancer. I remember sitting on the edge of my bed and just thinking, how was I even gonna take a shower? And sometimes I couldn't. Sometimes I literally had to take a bath because I didn't have the energy to shower. This is not a normal level of tiredness. This was bone deep fatigue that made even simple tasks feel like impossible. This level of fatigue, it's driven by inflammation, anemia, lean muscle loss, sleep disruptions, and the emotional load of being diagnosed with cancer. Now, here is what most cancer survivors get wrong. They think the solution to getting their energy back is to just rest, but that doesn't work. Now, rest matters, but too much rest actually makes your energy even worse. Muscle mass can drop really quickly during chemotherapy. When muscle drops, metabolism slows. When metabolism slows, energy drops even further. The fix to low energy is targeted nutrition. Your protein intake needs to be intentional. Most women need at least 1 gram per kilo of body weight of protein. This is to protect your lean muscle mass. But this is a bare minimum basement goal. If you actually want to get back to full energy, you're going to need even more than that. The bad news is that most cancer survivors are not getting this level of protein. The next thing you need to build in to get back to full energy is targeted movement. Strength training, even with your body weight or light resistance bands, that has been shown to reduce cancer-related exhaustion. Do this twice a week. Now, inside the Cancer Freedom Program, my first focus is always to rebuild your energy first. I work with a breast cancer thriver who planned her entire day around taking a nap. She was not the type of person who liked taking naps. So we corrected her protein, we added in progressive strength training, and we stabilized her blood sugar. Within 3 weeks, she didn't need her afternoon naps at all. Now look, low energy or exhaustion because of cancer or chemo, that is unfortunately common, but that's not normal. Living in constant exhaustion doesn't need to be your reality. Okay, but on to number 2, weight gain. Many people expect to lose weight during chemo, but today, it's more common to gain weight. This is especially true for women who are taking steroids or who are on hormone suppression therapy. Now, muscle loss combined with lower movement during your treatment, that actually lowers your metabolic rate. Then add in treatment-induced menopause and estrogen shifts. That's actually going to promote abdominal fat storage. And then the biology behind this becomes really clear. Weight gain after chemo, that's not a character flaw. That's not something you've done wrong. It's actual physiology. The solution is not extreme or restrictive dieting. Severe calorie restriction, it actually worsens weight gain in this case. It's gonna slow your metabolism even further. Instead, focus on rebuilding your body composition. Adequate protein, progressive strength training, fiber intake that's at least 30 grams a day. That's all gonna support your blood sugar stability. Now, we have research specific to breast cancer. The research consistently shows that maintaining a healthy body composition after breast cancer lowers your risk of a cancer recurrence. This is about reducing inflammation and improving insulin sensitivity. This is not about chasing a number on a scale. Many women say to me, I know it's vain, but I want to lose weight. This is not about vanity. It's about your health. A woman I work with inside the Cancer Freedom Program, she was feeling defeated because she was eating clean, but she wasn't losing any weight. In fact, she was gaining weight. When we looked closer at the data behind her nutrition, we saw that there were clear misses. She was under-eating on protein. She was avoiding strength training. She was under-eating on fiber. Once we corrected that, then her body began to respond. Now, weight gain, it might be a common side effect of chemo, but it's not your future. You can change it if you want. Okay, on to number 3. Anxiety and fear. This came up repeatedly when I asked cancer survivors about the worst side effects of their cancer treatment. And the fear and the recurrence, that can linger. Fear before scans, fear with every ache and pain. Now, as someone that's both a cancer survivor and who has doctorate level training in this area, I know the emotional side and I also know the stats. But knowledge does not erase emotion. After my stage 3 cancer diagnosis, every follow-up appointment felt really heavy. I knew the data, but I was still human. Anxiety in this setting, this is not weakness. This is understandable. The fix begins with regulating your nervous system. Cognitive behavioral strategies around anxiety and fear, this is well established within a cancer population. Structured mindfulness actually reduces anticipatory anxiety. Regular exercise improves your mood. This is also going to increase your endorphins and actually improve your sleep. Now, that same breast cancer thriver that I was speaking about before, she used to spiral for days before her oncology appointments. So we created a structured pre-scan routine. This included breath work and cognitive reframe. Over time, her anxiety became significantly more manageable. Fear, it may show up, but it does not get to control your future. Okay, but on to number 4. Hot flashes. Hot flashes are especially common in women who have undergone medical menopause. Medical menopause can happen from chemo, surgery, or from hormone blockers like tamoxifen or anastrozole. Now, estrogen helps regulate your hypothalamus, and this is an area of the brain that's responsible for temperature control. When estrogen drops, your brain misinterprets this as changes in body temperature. You're now overheating. Up to 70% of women on endocrine therapy or hormone suppression experience hot flashes. These are not mild, warm episodes. These disrupt your sleep, soak your clothing, and they increase your irritability. Makes sense. The fix is to start with foundational lifestyle changes. Let me explain. Regular exercise has been shown to reduce the frequency and severity of hot flashes. Maintaining a stable body weight helps. Avoiding triggers that are commonly known, like alcohol or caffeine. Blood sugar swings can also worsen hot flashes. You want to balance your meals with protein, fiber, and healthy fats. That's essential. Plus, we know that hot flashes are linked with mindset. Women that have higher anxiety or fear, they actually have 3 times the number of hot flashes. So if we can start to integrate a progressive relaxation strategy or meditation, you can actually significantly drop your hot flashes just through that. Now, hot flashes, they are common, but it's absolutely possible to be hot flash free even when on hormone suppression. Okay, but on to number 5. Brain fog. Many cancer survivors and thrivers, they describe difficulty with concentrating. They're forgetting words, they're struggling with multitasking. Now, chemo-related cognitive changes are really real. Studies show subtle alterations in your brain's white matter. This interferes with connectivity. It influences inflammation, and it also plays a role in sleep disruption. Now, as someone whose entire identity was tied to academic performance and research, this was an issue. It was really unsettling for me. I remember reading the same paragraph over and over and feeling very frustrated. But the good news is that there's ways to fix this. Protect your sleep. Deep sleep supports brain repair. Targeted nutrition can also support improving chemo brain over time. And you want to train yourself cognitively, doing things like reading or puzzles or learning a new skill. Now, most cancer survivors do experience some improvement over time, but if you use these strategies, you can speed up that recovery process. Okay, on to number 6. Sleep disruption. Now, sleep disruption is both a driver and a symptom of other things. Anxiety, hot flashes, steroids, these all contribute to sleep disruptions. Poor sleep worsens fatigue, it worsens chemo brain, and it causes you to gain weight. The fix really begins with consistency. It's simple to say, but it's hard to do. Go to bed and wake up at the same time every day. Create a cool, dark sleep environment. Limit your screen time before bed, at least 30 minutes before bed. Avoid large, late-night meals that can cause sugar spikes that can then disrupt your sleep. Exercise earlier in the day to support that deep sleep cycle. Sleep is not optional in your recovery. It's therapeutic. Okay, but on to number 7. Joint pain and stiffness. This is particularly common in women who are taking aromatase inhibitors. Lower estrogen levels increases your inflammatory response. That's all going to contribute to musculoskeletal pain. Your instinct is often to move less because you're in pain, but this is exactly what makes it worse. Clinical trials show that regular exercise, both strength training and low-intensity cardiovascular exercise, reduces joint pain. Vitamin D levels also need to be checked and corrected if they are low. A deficiency in vitamin D not only increases joint pain, but it also increases your risk of a cancer recurrence. Movement supports circulation and it reduces inflammation. Okay, but on to number 8. An entire identity shift. Hair loss, scars, weight gain, hot flashes. This affects more than your appearance. It affects your identity. Body image disturbances after cancer, that's real. That leads to a lower quality of life and higher rates of depression. The solution is not force positivity. It's about rebuilding trust in your body through function. When you complete a workout you couldn't do a month ago, that feels great. When you see your lab markers improved, that's amazing. You begin to see yourself as capable again. Now, these side effects of chemo, they're common, but they're not permanent, or at least they don't have to be. Understanding them and how to reverse them, that gives you power. Now, the worst chemo side effects are not always what people expect. So now that you know, and if you're experiencing them, you know you're not alone. But the next thing you need to know is how to rebuild your body and your confidence long term. That's exactly what I'm breaking down for you in this next video right here. Click the link here and I'll see you in the next video.